Good afternoon, everybody. Today, we're here to talk about a very special topic. April is National Minority Health Month, a time dedicated to raising awareness around the health disparities that persist in communities of color and encouraging action to improve health outcomes through education, connection, and advocacy. This observance dates back actually all the way to 1915 when Booker T. Washington launched National Negro Health. It has since evolved into a national month of action supported by the U.S. Department of Health and Human Services. But 2025 has brought with it an added urgency. From the rollback of public health programs to the cultural war against diversity, equity, and inclusion, we're seeing critical health resources stripped away at a time when they are most needed. That's why I'm honored to be joined today by two changemakers whose mission is rooted in equity, dignity, and representation. The founders of Coils to Locs, Diane Austin and Pamela Schatt. They are reshaping what representation in medical spaces can look like, one textured wig at a time. Now, today, Diane and Pamela are joining us to talk about this important topic. So, welcome to the conversation, Pamela and Diane.
Hello, everyone.
Now, look, I want to start with the connection between hair and health, something that I think both of you are very passionate about. Can you talk about you've seen medical hair loss impact self-esteem and emotional well-being for women of color?
Yes. It's more than cosmetic and it's deeply emotional, like you say. When I think of my own personal story with traction alopecia and all the years that I felt ashamed about it, not attractive because I had this perceived flaw. As women in particular, we're socialized to do whatever we can to not be considered unattractive. In this case, having hair that's not good enough. We think that we have this flaw that we're not good enough. When you add women who are losing and have lost their hair for medical or any other reasons that may or may not grow back, it's emotional. It's emotional. Tying that into hair and health, not to sound cliche, but I truly believe, I know Diane believes this too, that when you look good, you feel good, and when you feel good, you heal good. So that's tied into one another. If I can just bring up one point where Dr. Thea James, who is featured in our first company video, she is the chief medical officer at Boston Medical. She shared with us that some women will forego chemotherapy when they're told that they'll lose their hair. That's how traumatic it can be for some people. And some people might judge that decision, but it's real. And it's heartbreaking that women might do that. But it really just speaks to how hair and health are tied together.
Thank you for that. Now, Diane, would you like to add to that perspective?
It would, and as Pamela said, that hair and health are intricately tied together. There's data that shows that there are women who will forego various types of treatments like chemotherapy or other treatment because they're going to lose their hair, because we live in a society that has elevated hair for women as a standard of beauty. You can't go online or watch a television show or look at an ad where beauty is often tied with how our hair looks and how it feels and how long it is or not. And so we have this relationship with hair that is tied to our personality. So when you lose it, particularly as a woman, it has an emotional impact sometimes, just can't be measured and real and legitimate. And so it's important to be able to have resources that help women maintain their sense of self and their self-image. Me personally, when I was losing my hair and knew that I was going to lose my hair due to chemotherapy, it was like a gut punch for me. I was trying to imagine myself without hair. My personality and sense of self was tied to my hair, and people can judge that if they'd like, but unless you're in that person's shoes and have experienced that or have been close to someone who has experienced that, sometimes it might be hard to understand why there's such a profound sense of loss. So if there are ways to support women who may be making decisions based on hair loss that could impact their health, why not embrace wigs or whatever it is you need to embrace in order to move forward?
I love that. And this is the month, National Minority Health Awareness Month, created to shine a light on disparities like this. Why is your work so aligned with this month's mission?
National Minority Health Month is about shining an even brighter light on the disparities of people of color in the healthcare system. And that's what Coils to Locs is all about. We're shining a light on a healthcare disparity, which is the lack of coily curly wig options in hospitals and in other hair loss boutique spaces. And as a byproduct, leads to Black and brown women not having as private and dignified an experience as others who have straight hair. We like to drive home the fact that wigs for medical hair loss is not a vanity product, it's a necessity.
I think it's important for people to understand the depth of the disparity in this space because some people might be thinking about it on a very surface level, such as how is not finding a wig at a hospital a disparity? Here's where the disparity comes in. One, if you have health insurance that covers the cost of a wig for medical hair loss, which many health insurance plans, at least the private ones, will cover, you're not able to use that health insurance. And this was my experience because I could not find a wig in medical settings that reflected who I am and how I want to present myself to the world. So losing the opportunity of use my health insurance because these hospitals in medical settings that are supporting patient needs through wigs are only carrying straight hair blades, and my hair is not straight. So that's disparity number one. Number two, yes, many of us know that, particularly in communities of color, there are beauty supply stores where you might be able to go and get a wig. And depending on the beauty supply store, the quality of the wig may be questionable. But if you choose to go to a beauty supply store and you're losing your hair, unlike the hospitals where you are brought into a salon type setting in a private room where no one has to see that you're going bald or that you're bald, you can try on wigs to your heart's content, often with a licensed cosmetologist helping you through the process. At a beauty supply store, your only choice is to try a wig on in the middle of the store floor around customers. Not everyone wants to be in the middle of a busy store floor trying on wigs when they are losing their hair. So that whole experience is what I always call like a secondhand experience. You don't have that elevated, caring, empathetic experience that you get in a medical healer salon or a hospital that is catering to patients' needs. So that's the other piece of the disparity. And then lastly, just feeling invisible because you're going into these spaces that say they're there to support their patient population, but you're recognizing they really don't support you because they don't see you. They don't see that your hair is different because they're only selling straight haired wigs. So it's almost like you are invisible or you're not as important. So there's so many different aspects as to why this is important. And it ties back to people making decisions about getting treatment because they're going to lose their hair. So it's this cyclical, systemic issue.
Absolutely.
The connection between your brand and your mission and the current attack on DEI initiatives, has that essentially thrust your brand into the position of being one of the resistors out in the culture and one of the ways that Black women specifically who are in need of these culturally sensitive wigs can really engage in this brand as a way of continuing to resist this backlash against DEI. Can you talk a little bit about that?
Regardless of whether we're using certain buzzwords like DEI, the now dreaded D word, diversity, it doesn't matter. We're passionate about and committed to what we're doing in this space. And that will never change. That will always be our beautiful resistance. And it also makes me think of when we launched 4 months before the pandemic and the hospital boutiques having to shutter their doors because they weren't considered essential. Cancer didn't go away. People getting chemotherapy treatments and treatments for other illnesses didn't go away because something wasn't considered essential or given credibility. Hair loss didn't go away. Everybody had to pivot, still do the work. We still did the work that needed to be done. This is no different. Whether we use the word diversity, whether we talk about DEI, the work is still going to be done. We're still going to be passionate because we're in it for reasons other than what a few words will or will not do.
So, extending that one step further, let's talk a little bit about what you are doing as a brand additionally to continue to extend to your community the support you feel they need. This is really embodied in your recent announcement around your buy one, give one strategy. So, can you talk a little bit about what that is and why it matters?
Absolutely. So we are really excited about this buy one, give one initiative because it ties into our mission, which has always been supporting communities around medical hair loss. We have always recognized that there are segments, our target market, that may not have health insurance coverage to purchase a wig, or they just may not have the finances to purchase a wig for medical hair loss. We wanted to be part of the solution by making our customers aware that we're launching this program. If a customer wholesale or our direct, we will give one wig away. And we are working, we'll be working with hospitals to ensure that these wigs are given to those in need. We want to support cancer resource organizations as well. And we want our customers to know that purchasing a wig from us will result in donating a wig to a woman who may not be able to financially afford a wig. They want a wig, but they're focused on other things. And to be able to give someone a wig.
What does equitable access to care look like to you? Because I think equitable access to care looks different for many people. And Diane, in your founder story, you clearly point out an area where equitable access to healthcare matters in a way that I think people don't typically think about. So can you talk a little bit more about that?
Absolutely. Equitable access to care. One of the first things that comes to mind is feeling included and knowing that your needs are important. So being able to walk into these spaces that they're marketing that we're here for you as a patient and we have resources for you. You go into these spaces and they really don't as it relates to wigs because they're only selling straight haired wigs. Equitable access means to be able to walk into these spaces and see a wig that looks like the hair that you lost or that you're about to lose. Just asking people what they're looking for and not assuming it's a one size fits all proposition. That any woman walking into the salon is going to be interested in the wigs we are displaying, and you're only displaying straight haired wig. And that was just my experience personally as a patient and just feeling frustrated by it.
In a nutshell, equitable access to care means not having to second guess whether something is for you or not. For example, walking into a space and seeing a representation of yourself and knowing without question you belong there, that you're seen and you're heard.
And one of the things that we have learned from hospitals is this perception Black and brown women or women with textured hair aren't looking for these wigs. We've actually been told by a couple of people, no one's asking for the wigs. But what they don't recognize, and again, data is queen. If you look at the data, there are studies that show Black women in particular will assume that you don't cater to them if they don't see the product that they're looking for displayed. So if you're not displaying any other types of wigs, then you must not carry them. And that leads to these perceptions of feeling invisible, feeling like nobody cares for your preferences. And so we encourage hospitals, you need to display the wigs. You need to communicate to your patient population that these wigs are available because unfortunately, Black women are used to being in spaces, in retail spaces that are not catering to them. You're not going to ask for what you need. You just assume they don't carry it or that they don't care to carry these types of wigs. So if your mission is to meet the needs of all of your patients, you need to do the extra mile, which is display the wigs so people know that they're there. Let the oncologists know, the patient advocates and other people in your healthcare setting know that equity is important to you, inclusion is important to you, and we have these wigs.
I agree with that. Many people have misconstrued what equity really means, right? And we know that equity doesn't mean one size fits all. That is clear in your message, and I appreciate you clarifying that. It's about showing up for people where they are and honoring how they like to show up in public and for themselves. And so, to your point, if there's no representation of my hair texture when consumers want to go out and look for a Coils of Locs wig, where do they find them? Can you talk a little bit about where Coils of Locs wigs are currently carried and where they can find you guys online?
We're in 27 hospitals across the country right now, and we have compiled links to those websites right on our webpage, which is coilstolocs.com. There's no K on Locs, so COILSTOLOCS.com.
And let's not forget about your We Funder campaign. I would be remiss if we ended this conversation without directing our listeners to make sure they go out and check out Coils to Locks on wefunder.com. You just need to go to the platform, type Coils of Locks in. Remember, Locks without a K. So Locks without a K, type it in, drop $100 or more. The minimum donation amount is $100. And so I think that's a very fair ask for a brand with a very noble cause and an opportunity to support brands like Coils of Locks in their effort to really define equity in a way that meets people where they are versus one size fits all.
There are thousands of hospitals here in the US. 1,500 of them are federally cancer designated hospitals. We're in 27 hospitals now. We should be in more than 27 hospitals. We need individuals to raise awareness at the cancer center hospitals that you engage with. And we'd love for you to reach out to those hospitals and let them know about our business and suggest that they reach out to us to learn more. You can direct them to our website, coilstolocs.com. We want to move from 27 hospitals to at least 100 by the end of the year. And you can help us with that, sharing on social media, investing in our crowdfunding campaign. Businesses like ours get less than 1% of investment dollars. So instead of trying to push our way to an existing table, we need to create our own table, our own seat at the table. And that's what crowdfunding does for businesses like ours. And it's an opportunity for you to potentially invest in a high growth business that is a multi-billion-dollar industry that we plan on getting a big piece of the pie. So you can help a social impact mission and potentially increase your wealth by investing in Coils to Locs.
Wow. You heard it here first. A lot of great information shared today. As you can see at the bottom on the ticker, there are also Coils to Locks links to the various social media platforms. And I cannot encourage you enough to make sure you go out to the We Funder campaign and also invest, not donate, but invest in Coils to Locks today. And with that, we thank you for this special conversation around National Minority Health Awareness Month. I encourage you to go out and share this information as part of the campaign initiative this month, which is to raise awareness around the many various opportunities that we as a community can do to improve our health. So thanks again for joining us, and thanks both of these wonderful ladies for really educating us today about the opportunity to support their wonderful brand, Coils to Locks. And I encourage you to go out and follow them on all of their various platforms. Thanks again.
Thanks, Dana. Thanks, everybody.
Thank you. Hi, it's Diane Austin with Coils to Locks. Today, we'd like to shout out Roswell Park Comprehensive Cancer Center in Buffalo, New York. Thank you, Elevate Salon, for partnering with us, believing in us, and bringing diversity and inclusion and equity into your cancer center through featuring coily curly wigs for your patients. Today, I'd like to elevate Roswell Park Comprehensive Cancer Center in Buffalo, New York. Elevate Salon features Coils to Locks wigs, and we love partnering with you. Thank you for bringing our wigs to your patients. It's Diane Austin with Coils to Locks. Rush Copley Waterford Place Cancer Resource Center carries Coils to Locks wigs. We're thrilled to partner with you, and we want to give you a shout out. Thank you for partnering with us. Today, I'd like to highlight the Shine Boutique, part of Seattle Cancer Care Alliance in Seattle, Washington. Thank you for bringing Coils to Locks wigs to your patients. I'd like to thank the salon at 10 Newberry Street for believing in our mission and making Coils to Locks wigs available for your customers. Thank you for being such a great partner.
Hey, everybody. Today, we want to give a shout out to the wig doctor, Dr. Erica Gamble in Marietta, Georgia. Thank you for your partnership. We love that you're committed to equity and patient dignity, women experiencing medical hair loss, and the support that you give. Thank you for partnering with Coils to Locks. Today, we're giving a huge shout out to the University of California and San Francisco Health. If you or someone you know is navigating hair loss due to cancer, treatment, alopecia, or other medical conditions, stop by UCSF and ask for Coils to Locks wigs by name. Thank you for your partnership. Hi, everybody. I'm Pamela, co-founder of Coils to Locks, where we believe that representation is essential, especially when it comes to medical hair loss. And today's shout out is going to UVA Health in Charlottesville, Virginia. Thank you for your partnership. If you or anyone you know lives in the Charlottesville area, go in, ask for Coils to Locks by name, and thank you, UVA Health, for your partnership. Today's shout out goes to the very best little hair house in Sharon, Pennsylvania. Thank you for standing with us in the fight for health, equity, and inclusion, one wig at a time. And if you live in the Sharon, Pennsylvania area, go in, show her some love and support, and ask for Coils to Locks by name.